Good afternoon, everyone. I hope everyone can hear me okay. Firstly, I'd like to thank Carmel and the organisers for giving me the opportunity to speak to you today. I'm going to focus on a piece of work that I was involved in. It was largely carried out by Sarah Cronin, and Mary Lynch was involved in the work as well. And it's about supporting people with dementia to die at home in Ireland. So today I'm going to try and answer these three questions about where people with dementia die, the factors that support people with dementia to die at home, and what would enable more people with dementia to die at home in Ireland. So we know that most people in Ireland want to die at home, but only 26% of people get the chance to do so. In fact, 43% of people die in acute hospitals and 25% die in long-term care facilities. What's really interesting is that only 6% of people die in hospices, and I'll talk later on a little bit about that and access to hospice care for people with dementia. When we look at the cause of death, most people in Ireland die from heart and circulatory disease, and cancer comes in second. Last year, the CSO started gathering data in relation to dementia and Alzheimer's deaths, and when I was putting this together, data for the full year of 2017 wasn't available. But from quarter one to quarter three, 1,800 people died with a diagnosis of dementia and Alzheimer's disease. So we work out that approximately 7.7% of people in Ireland die from dementia. So where do people with dementia die? So we estimate that 4,200 people die every year with dementia. Over half of them die in residential care facilities, and largely that's because the services are structured to move people into long-term care facilities rather than to support them to stay at home for longer. 1,680 people die in acute hospitals, and only 210 people die at home. As I said, that's largely because of the way the services are structured. If we look across Europe, it's not an uncommon situation that a very small number of people get an opportunity to die at home. Across Europe, rates vary from 3.3% in Wales to 16.4% in Belgium. Within England, less than 5% of dementia patients die at home, and people are 4 times more likely to die in residential care, while 2 in 5 people with dementia die in hospital. So looking at the Irish context, the Irish Hospice Foundation fund a Nurses for Night Care service, and that's a service that's delivered through the Irish Cancer Society. That service supports people with illnesses other than cancer to die at home. So we support the Irish Cancer Society to extend their service to people who don't have cancer. That service is accessed through the specialist palliative care teams. Last year, 579 people received the service, and there was 1,968 nights delivered. When we look at the breakdown of the service, about 20% of the people who access that service have a diagnosis of dementia. So the service was established in 2006, and since it came into operation, the numbers accessing the service has increased year on year. The biggest increase was between 2015 and 2016, which seen a 37% increase in the number of people with dementia accessing the service. So we decided to look at what are the factors that enable people with dementia to die at home, and what would enable more people to die at home. So we carried out a literature review that looked at these issues, and these are the things that came up as being important or being relevant to enable people to die at home. They were personal and demographic factors that included carers, gender, age, marital status, level of education, presence of an advanced care plan, and socio-economic status. The disease-related factors were in relation to diagnosis, a comorbidity, symptom management, and the experience of pain. And the environmental factors were whether you were living in an urban or rural location, the availability of local services, hospital and residential care beds, access to equipment, and formal supports. So we carried out an audit on the night nursing service between July and December in 2015. So we asked for supplementary information for all referrals that came in over that period. So we asked the referring teams about demographics to include gender, age, address. We asked them about the length of time that people were involved with the specialist palliative care team. We asked about the reason for referral, what supports were in place to include formal and informal supports, and what care was provided in the home. And this enabled us to get a picture of the key components of care that enable a person to die at home with dementia. So what we found, this is a busy slide, so this is just an overview of our findings of that audit. So 41% of people lived in an urban setting, and 44% in a rural setting. It was mostly women who accessed the service. When we looked at comorbidities, 28% had no other comorbidity, 17% had 4 other conditions, and 6% had 7 or more. When we looked at the services that were involved, what is really important is that 40% of people indicated that having a supportive GP was really important, and 63% of people indicated getting a home visit every week from the GP. The other community supports that were important were the public health nurse, who was involved in 77% of cases, and 89% of people had a home care package in place. When we looked at specialist services, to include specialist palliative care teams, psychiatry of later life, and other specialist services, 7 out of 10 people were known to the specialist services, the specialist palliative care team, for less than a week, which is a really short space of time, considering that people with dementia have palliative care needs. The biggest and overwhelming finding really was the role of families in the provision of care, and their role in enabling people to stay at home for as long as possible. So 3 out of every 4 families were providing care on a 24-hour basis, and a small number of people were supplementing home care packages with their own personal income. Families also reported that having access to specialist services as being really crucial as well. And what was really interesting when we looked at planning ahead was that only half of the sample had indicated through an advanced care plan that they wanted to stay at home. So this is just a breakdown of the formal care provided, and I suppose the biggest thing is that last bit, and again it highlights the role that family carers play in enabling somebody to stay at home and die at home with dementia, with a majority of people providing care on a 24-hour basis. When we looked at the formal supports that were available, as I said, the GP was a key person providing care and enabling somebody to stay at home for as long as possible. Home care packages, they ranged from 2 hours to 20 hours, which really people indicated wasn't really enough support for them. Out of hours providers, which provided the flexible care. As we know, people need care not only between 9 to 5, but after hours and through the night. Public health nurses and other healthcare professionals, to include physios and OTs, played a role as well. So what would enable more people with dementia to die at home in Ireland? The first 2 points here relate to advanced care planning. So early advanced care planning is key in relation to caring for somebody with dementia, and not just on a one-off basis, but on an ongoing basis. Staff have a responsibility to share information. So if a person is at home, a lot of the time they're accessing a load of different services, and sometimes those services don't always talk to each other. So it's really important that services speak to each other, and that if somebody does have a wish to stay at home, that it's communicated to other healthcare professionals. GPs and out-of-hours services as well, they need to be supported to provide care after hours and through the night, and staff should ensure a timely referral to the specialist services that are available. So what would help? Obviously, as an organisation, we're advocating for increased home care packages. We're working with GPs, and we've supported 3 GPs to put a proposal together in relation to the GP contract negotiations that include advanced care planning and increasing their availability to deliver home care visits to people. We're also involved in a campaign that a lot of other organisations are involved in, a Right to Home Care campaign that's largely led by the Alzheimer's Society of Ireland and Age Action Ireland, and that's really crucial. And the aim of that campaign is to move services away from funneling people into long-term care to keeping them at home for as long as possible. Again, there's a need for dementia-specific services. Specialist palliative care services and specialist dementia services as well need to be made available. We also advocate for the needs of carers, and we advocate that healthcare staff should look at the needs of carers to include their bereavement needs from the time of diagnosis and after death as well. And as well, as an organisation, we'll be bringing those things forward, and we'd support research in this area. This is a quote from the NHS, but I think it's appropriate in the Irish context. While a good death at home may not be feasible or desirable for everyone, it could undoubtedly be a reality for many more if we nurture the services to support it. And finally, just some other resources that are available in relation to palliative care and dementia. A suite of 7 guidance documents were developed, and they're aimed at healthcare staff across all healthcare settings, and look at things to include having conversations, advanced care planning, loss and grief, hydration and nutrition, pain, ethical decision making and medication. With the Alzheimer's Society of Ireland, we developed 4 information leaflets that look at advanced care planning, understanding late stage dementia, loss and grief when a family member has dementia, and grieving following the death of somebody with dementia. There's a Think Ahead form as well, which I think a lot of people might be aware of. It's a public forum that helps people have conversations, but it also helps them to write down their wishes about what they want for their end of life. We had the privilege of working with Cathy Ryan to develop a suite of videos where she shares her story about receiving a diagnosis, and she talks about the importance of advanced care planning, and they're available on the Irish Hospice Foundation YouTube site, and we have a range of training and education that is made available to people as well. So that's it. I know there's questions afterwards, but there's references as well.